Hello, this is Dr. Eric Su. I'm talking to you about wellness exams this month for my video blog. I have a lot of patients who do call us and complaining about their bills on wellness check or their annual physical. Why am I charged an office visit on top of my physical? And this is the best analogy I can give you. When patients come in for their annual physical exam, which is to kind of cover for screening for like cholesterol, making sure if you're a female, you had your breast exam, mammogram, pap smears done. If you're a male, getting your prostate checked, making sure we screen for cholesterol, heart disease, blood pressure check, and all that stuff. But when you come in and say, well, I need a refill of my diabetes medication, my cholesterol medication, and I need to get an extra blood work to check this and that, that is not a wellness check. That is a problem visit. And so if you're coming in for a physical and you also have a whole bunch of other stuff that we got to do, we do charge an office visit for that. And why do we do that? Well, because the insurance is telling us to do that. We have kind of been combining an office visit and a physical together for many, many years, and we've been doing it. However, what we're finding is that a lot of patients are also taking an advantage of that as well by coming in for a physical, but then have a list of like 5 or 6 things that they want to discuss that are more problem focused. I have a headache. Oh, I've been having more chest pain. My stomach's been bothering me. I have a rash. Oh, I have something else that's going on. My mood's a little bit off. So when we discuss about things like that and we document, we may order a chest x-ray or EKG or other blood work. I may refer you to a counselor. I may refer you to a massage therapy, physical therapy, or a cardiologist. Nonetheless, all those things are documented. We have to order additional blood work, labs, consultation report. That's why we generate an office visit for that. So you have 2 choices. Either come for an office visit and then be done with just the office visit, come in later for a physical, or you can do an office visit plus a physical at the same time. In the past, we built them as a bundled visit, but we are now separating it out because patients are getting smarter and they are taking up an extra time during the physical trying to get this stuff done out of the way. So nonetheless, that's why there's 2 visits. Usually there's a physical visit and then there's an office visit if you are talking to us about any additional things that are not really covered under a wellness visit. I'll give you a quick example. You take your car into the mechanic for an oil change, but during the oil change you tell them that the brake is squeaking and then also the air conditioning is not as cold as it used to be. So the mechanic goes and does his normal oil change, but he does find that the brake pads need to be replaced. The Freon needs to be also put in the AC unit as well. So he comes back and says, oh, here's your charge for the oil change, but here's an extra charge for your brake pad change, and here's an extra charge for your Freon. And then you probably just go and pay for all of that. You wouldn't say, well, I just came here for an oil change. So kind of the same thing when you come in here for just a physical, that's what we're built for. When you come into a physical with a list of complaints that we need to address, or you have a list of health issues that we need to review, refill medication, order additional blood work, things like that, that is another office visit. So I hope that explains the billing issues that a lot of patients have been questioning. And so this is my continuation of the FAQs. Keep sending those questions to me, and I'll do my best to address them with my video blogs. Have a great Thanksgiving, and then I'll talk to you guys later.